Hello, good afternoon. Thank you so much for joining for my talk today. My name is Dr. Rajeev Tandon, and I am the Medical Director of VIP Fibroid Center. I hope to make it worth your time. I know your schedule is very busy, and I really appreciate you taking the time out of your schedule to learn today about uterine fibroids and some of the non-surgical ways that we can treat them. To give you a little background on myself, I completed my fellowship in 2003 at UCLA in interventional radiology. Interventional radiology is a specialty that focuses on treating diseases using minimally invasive processes. And I had the benefit of that time from getting trained from one of the pioneers in the fields of treating uterine fibroids using these techniques. And since that time, I've been fortunate to be able to treat thousands of women with uterine fibroids using those techniques. And it's been very fulfilling and gratifying to see their symptoms get relieved through this process. A quick housekeeping note before I begin the talk. If you have any questions that come up during the talk, you can type them in the question box on the Zoom interface, and I will try to address them at the end of the talk. Or alternatively, you can just email or call Monica with your question, and we will get back to you and try to answer it for you. Okay. So with that, I think I'll go ahead and start the presentation. Okay, and also forgive me if any technical glitches happen. We're all getting used to this new age of doing Zoom webinars, and I am myself getting used to that. Okay, so I'm assuming that people listening to this talk today women listening to this talk are either concerned about, have, or been affected by, or are being affected by uterine fibroids in some way. And so my main goal from the talk will be to give you the information and facts that you need to help you, empower you to make the treatment decisions that are right for you. First, I just wanted to address a few of the myths surrounding fibroids and the uterus. First myth is that many women believe that fibroids are cancerous. This is not true. Fibroids are benign or non-cancerous growths that occur in the uterus. A second myth is that most women don't have fibroids. Now, although not every woman with fibroids will develop symptoms, actually most women will develop fibroids at some point in their lives. So this is a very, very prominent disease among women. The third myth is that either you live with your symptoms or you have surgery. And this is one that's really important because a lot of my patients have lived with their fibroid symptoms for many years, and they're really terrible symptoms. And the reason they live with them is because they don't want to have surgery. And when they find out that there's another alternative to having surgery and yet they can relieve their symptoms, it really is a life changer for them. The next thing is that hysterectomy or surgery is the only effective treatment. Well, this relates to number 3 in the fact that we have very effective non-surgical treatment that can relieve symptoms for patients without having to remove the uterus or without having to undergo a more invasive surgery. And the last myth is that the only function of the uterus is for childbearing. Medical science is finally starting to recognize and discover the importance of the uterus outside of childbearing, and I'll touch on that a little later in the talk. A couple of facts about about fibroids in the uterus. One is that they can severely decrease the quality of life of patients who have them. Not every woman will have symptoms, but for those who do, it's hard to impress how bad those symptoms can affect their quality of life due to either bleeding or pressure and pain symptoms, and interferes with work and activities and family life in so many different ways. Fibroids can be safely and effectively treated without surgery, and I'll talk to you in more detail about that. Women are not being told about their non-surgical treatment options. And this has been an issue which I'm trying to actively promote against by doing webinars and talks like this, so women are aware of the treatment options and know what they can do to treat their fibroids. And hysterectomy and surgery is not the only option for women, and the uterus can be preserved. And this is a key message that I try to let patients know, is that they don't have to have their uterus removed. A few facts and figures to kind of highlight some of these myths. This is based off of a Harris poll in 2017. And the poll basically showed that women, US women, really are not that knowledgeable about fibroids, despite most of them having them. 28% of women have never heard of fibroids. 57% of women don't feel like they're at risk for fibroids. And 19% of women feel that they are cancerous. So these are all myths that we're trying to correct through spreading of knowledge. So to give you a little basic education about fibroids, you know, they're common yet unknown to women. And a fibroid, or it's also sometimes called a leiomyoma, it's a type of benign, which means non-cancerous growth that occurs in the muscle cells of the uterus. These growths do not spread to other regions of the body, and they're typically not dangerous, but they can cause lots of severe symptoms for many women. Symptoms can include heavy menstrual bleeding, uterine pressure or pain, abdominal enlargement, pain with intercourse, constipation, and frequent urination. These symptoms are easy to list off in a talk, but for women who are suffering from them, it really interferes with their quality of life in so many ways. The diagnosis of fibroids is typically made first through a history and physical to have an idea that you're having some symptoms, and then it's confirmed with imaging of the pelvis using either ultrasound or MRI. And here's a picture of a fibroid. Moving on to risk factors and size of fibroids. There's limited information about the precise risk factors for uterine fibroids. Women are seen to be at increased risk for fibroids if they're African American, if they're over the age of 40, if they have high blood pressure, if they're overweight, or if they have no children or have immediate family members with fibroids. But despite these subjective risk factors, even with no risk factors, many women, in fact, a majority of women go on to develop fibroids. The fibroid sizes can range from anywhere from a quarter of an inch to larger than the size of a cantaloupe. And in fact, 20 to 40% of women age 35 or older have uterine fibroids of a significant size, meaning that they're a larger size fibroid. Okay. Now, the type of fibroid and where the fibroid is located can influence the symptoms that a woman is experiencing. They can occur in multiple locations, and most fibroids occur in the wall of the uterus. Many fibroids can occur in what's called the submucosal region, or abutting the lining of the endometrium. These fibroids in particular tend to cause a lot of bleeding problems for women. And then subserosal fibroids can kind of bulge out of the uterus, and these fibroids can cause problems with urinary frequency or bulk symptoms that women may experience. The other thing to remember about fibroids is they're very vascular. They draw in lots of blood supply, and that contributes to a lot of the bleeding problems that women have. So let's discuss the surgical treatment options for fibroids. Most women are familiar with these options. These are what they're mostly they hear about from their OB-GYNs, and it's mostly spread you know, through day-to-day conversations. And those involve myomectomy and hysterectomy. Myomectomy is a surgical removal of one or multiple fibroids, and hysterectomy is a complete removal of the uterus and possibly ovaries. Ovaries are removed in approximately 50% of hysterectomies. Myomectomies can only be performed with certain types of fibroids, and generally each fibroid has to be removed one at a time, and not all fibroids can always be removed. Both procedures can be either performed as an open procedure or sometimes as a laparoscopic procedure if the fibroids are the right size and there's other factors involved. Recovery for these procedures ranges anywhere from 2 to 4 weeks for a myomectomy and 6 to 8 weeks for a hysterectomy. Both procedures generally require a hospital stay of anywhere from 1 to 5 days, and that can be burdensome for women to undergo. So hysterectomy is an invasive and often unnecessary option. You know, 1/3 of women will get a hysterectomy before the age of 60 in the US. And almost 600,000 hysterectomies are performed every year in the United States. This makes it the second most common surgery after C-section. Unfortunately, many hysterectomies may not even be necessary, as our literature has shown. A study published in the American Journal of Obstetrics and Gynecology showed that 1 in 5 women who had a hysterectomy for a non-cancerous condition didn't have the evidence to support the need for their surgery. Additionally, 40% of women who got a hysterectomy to treat non-cancerous condition did not receive other treatments before undergoing the hysterectomy. This is unfortunate because it's a major operation, and women should receive the option to have other treatments before undergoing that operation. So it appears that many women are undergoing the procedure without knowledge of their other options available. Unfortunately, hysterectomy is also presented as the only or one of the best options to treat a patient's fibroids, and that's just not true. So why do women want to avoid hysterectomy? This thought process has changed, over the last few years. For hundreds of years, literally since the 1800s, the uterus was primarily thought of just as a baby house and, a quote unquote, useless organ that after childbirth didn't have a function. And so the solution to any female pelvic problem or pain problem was simply to remove the uterus and the pelvic organs. And now science is starting to catch up with us, and we now believe that women's reproductive organs have value beyond their reproductive capacity. Studies are starting to see that estrogen and other hormones produced by the ovaries, in conjunction with the uterus, help promote cardiovascular, skin, bone, and urogenital health. And we now know that the uterus and the ovaries are closely linked through nerves, which connect both the ovaries, the uterus, and the brain. And some studies are starting to look at this connection and starting to see some ties to hysterectomies and risk of early onset dementia. And the uterus is now seen as an important regulator of brain function. And finally, and very importantly, the psychological impact of having hysterectomy really can't be understated. Many women find this to be very difficult because they identify their uterus as part of them and as part of their womanhood, and especially if they've not yet undergone menopause. And it can be a key part to a woman's self-identity. And so the loss of the uterus can often lead to both short and long-term depression in many women. So this brings us to another option for women, a non-surgical option. It's called UFE, or uterine fibroid embolization. Uterine fibroid embolization avoids surgery, it controls symptoms, it improves quality of life, and it preserves the uterus, which is very important. UFE is a minimally invasive treatment. It's performed through a tiny pinprick in the wrist, and a catheter is guided via imaging to the vessels leading to the fibroids. And through the catheter, small particles are injected to block the blood flow leading to the fibroids, causing the fibroids to shrink and to disappear. UFE was introduced more than 20 years ago, and it's now a proven therapy for the treatment of uterine fibroids and the symptoms. A key advantage of UFE is that it preserves the uterus and results in less pain and quicker recovery than surgical options. UFE allows women to not only experience relief from their symptoms, it allows them to get back to their lives more quickly and avoid early menopause, sexual dysfunction, and other side effects that can result from other treatments. Emerging research also shows that women may choose UFE to maintain their ability to have children. This is still an area of research, but thousands of women who have had UFE have gone on to have successful pregnancies. So one of the advantages I talked about is that we actually perform this procedure through a tiny pinprick in the wrist. And so patients simply go home the same day with a Band-Aid on their wrist, as opposed to some sort of surgical scar. And the way we do that is using advanced imaging technology, we advanced our catheter and tiny microcatheter all the way around and then into the vessels supplying the fibroids. And this allows the patients to go home within a few hours. They can curl up in a ball and be comfortable at home, and avoids a lot of other issues. Okay. So what can you expect after a UFE? Well, most women will have some pain, nausea, and low-grade fever after the procedure. It's known as post-embolization syndrome. The management of this has greatly improved since the procedure was first became popular 20 years ago. And through this experience, we've now developed great anti-inflammatory cocktails. We have good anti-nausea medications, and we have pain relievers that we're giving to patients before the procedure, during the procedure, and after the procedure to really minimize these symptoms. Generally, patients' symptoms will peak in the first 24 hours and then start getting better after that. They're usually back to normal in 1 week, and I see them in the follow-up in 2 weeks, and they're usually very happy by that point in time. Okay, so what does the OB/GYN community think of UFE? Well, their quote from their literature in 2008, their American College of Obstetrics and Gynecologists Practice Bulletin, which is where they list all their practice recommendations for that year, said that based on level A evidence, based on long and short-term outcomes, UFE is a safe and effective option for appropriately selected women who wish to retain their uterus. And this is a big deal because level A is the strongest level of evidence that medicine can give to any type of research that's done. It means that the recommendation is based on good and consistent scientific evidence. Now, unfortunately, despite this great procedure and great outcomes and low risk, only 44% of women diagnosed with fibroids have even heard of the procedure. And this is really an injustice to women. In fact, 3 out of 4, or 75% of women who have heard of the procedure didn't hear from it from their OB/GYN, the primary provider of fibroid treatment. Now, I'm fortunate to work with great OB/GYNs who refer me patients all the time, and they're really patient advocates. But not every OB/GYN may have the knowledge to share with their patients about the real details of the procedure, and that's understandable. If you go to Ford to buy a car, they're not going to be telling you how Teslas work, and because that's not the area that they're specialized in. And so that's part of the reason why the knowledge has just not been spread as much as we'd like it to do. And also that's part of my goal, is to spread the knowledge to women so they understand that this option is available for them. Another contributing factor of why women don't know about the procedure is that women don't talk about their symptoms or their fibroids to other women as much as they do about other things, because they could be embarrassed about the condition. They may not want to share their experience with others. And the silence around the condition has affected the knowledge of women knowing about treatments for it. So this is a really, I think important quote from a patient, because it reflects the experience that a lot of my patients have gone through who seek me out from an outside OB/GYN. They said they suffered for 5 years before I found relief. I visited 4 OB/GYNs who all recommended hysterectomy. Luckily, I found out about UFE, and it changed my life. Now, this is very important for many reasons. One is that it shows that women may unfortunately live with their symptoms severe symptoms for many years before finally being able to get the treatment for it, because they don't want to have a hysterectomy, and there's many reasons why they would not want to have a hysterectomy. And so that's understandable, but they're just not given the knowledge to know that there's another great treatment option available. And also the patient's symptoms, which can consist of heavy bleeding and a lot of pelvic pressure and pain, are really debilitating for their life. And once the symptoms resolve, they feel like they've gotten their life back, and it's very life-changing, life-altering for them. So for this next slide, this is basically a short video clip of one of my patients, Robin, who was gracious enough to share her experience with her UFE procedure with us earlier this year. So it's just about a 90-second clip, and I wanted to just play this for you so you can hear from one of my patients in her own words. Oops, sorry, I need to go back one.
I've always had very bad cramps. When I was 22 years old, after the birth of my twins, my doctor said to me, your uterus isn't going all the way down. She discovered that I had fibroid. She says, well, if they're not bothering you, then we can just leave them alone and we'll watch them. And other than a very bad cramp, there was nothing else was really bothersome. My husband and I at that time were not 100% sure that we were done having children. Fast forward, my period had been coming every 2 weeks. It seemed like my cramps were worse. The back pain was worse. Okay, I need to get to the doctor and see what's going on. Some of your fibroids have grown. So I was really pleased to find out that a hysterectomy wasn't my only option. I was happy to hear that there was another option, and it's been great. I do not regret it at all. In my period, my cramps that I've lived with from the time that my period started, I don't even have them anymore. If you can have a procedure that is minimally invasive, if that's an option for you, I just can't see why not. I never understood what women said, or what women would mean when they would say, oh, my period is just, it's not that big of a deal. It's just, you know, it's a little inconvenience. It's a minor inconvenience. It's never been a minor inconvenience for me, and now it is. I'm very appreciative to you and the doctor, because honestly, without you guys, I think I would still be suffering. And thank you guys again.
So I want to thank Robin for that clip. That was hopefully that was informative for you. So what are the take-home things I want you to know about uterine fiber embolization? Well, one, it's minimally invasive. It avoids surgery. The whole procedure is done through a tiny pinprick in your wrist under local anesthetic and conscious sedation. It relieves your symptoms. About 90% of women have significant or complete relief of their heavy bleeding, pain, or bulk symptoms from the procedure. It's a short recovery time. It's an outpatient procedure. Patients will go home the same day as the procedure and should be back to your normal self in about a week. And there's minimal complication risk. And really importantly, it preserves the uterus and it improves your quality of life. So kind of restating some of these things, UFE is a less invasive and less painful option. And many women choose to have UFE instead of a hysterectomy or myomectomy because the treatment is less disruptive to their life and it is minimally invasive. It's known to be less painful than surgeries, and it makes it a more appealing option for many women. One study showed that within the first 24 hours after treatment, women reported experiencing less pain with UFE compared to those who underwent hysterectomies. It's known to have a quicker recovery time. You women who have chosen UFE usually do so because they wanted the least amount of disruption to their lives. And multiple studies have shown that women who undergo UFE go back to work and return to their lives in a shorter amount of time compared to surgical treatments. And most patients will return back to work in an average of 1 week, according to one study, and according to our personal experience here at the center. Not only does UFE allow women to get back to doing what they love sooner, it's also been shown to improve the quality of their lives, which is really, can be understated how important that is. Several studies have reported that most women say that UFE significantly improves their quality of life 1 month after treatment, and it's reduced their menstrual bleeding and left them symptom-free. These improvements continue many years after the treatment, and women report a high level of satisfaction with the procedure, partly attributed to its minimal nature, and more women recommend this procedure than they would other procedures to their friends. Okay, so wrapping up. So UFE, it's a better way to symptom relief. I believe the least invasive option is the best option, and it's UFE is less painful, has a quicker recovery, and I also strongly believe that women deserve to know the treatment options and pick what's right for them, because not one treatment will be right for everybody. Women suffering from fibroids are not only looking for relief from their symptoms, they have multiple factors to consider. For some, taking the least amount of time off work is the most important. For others, being able to maintain intimacy with their partner's primary importance. And for others, may not be ready to enter an early menopause or don't want to lose their uterus. Whatever the reason, UFE provides women many benefits not found with more invasive treatments. And we as clinicians, we take these into factor so that we can give women every option available to them to avoid surgery. And UFE is a great option for women, and I believe women deserve to know about their options and this procedure. And if you'd like to learn more about anything that I talked about today, or if you'd like to get a consult, then I'd encourage you to just call our office or visit our website, and we can help you from there. With that, I'll just see if we have any questions. And we do. Okay, let's see. Okay, so there's 2 questions so far. How large should fibroids be before you consider such a procedure? So I don't base, it's not based on the size of the fibroid, it depends on the symptoms the patient is having. So it's not any particular size. I've treated tiny fibroids and I've treated very large fibroids, but I'm not treating the fibroid just to treat the fibroid. I'm treating the fibroid because we believe the fibroid is causing symptoms. I always do my treatments in a conjunction with an OB-GYN, whether it's the one you're currently seeing or one of the many great OB-GYNs that I work with. And we want to make sure that we're giving you the best care and treatment possible. So like I said, the short answer is that we don't look at the size to determine if we're going to treat or not. We look at your symptoms, and then we'll look at imaging, like either MRI or ultrasound, to make sure that we're trying to correlate your symptoms with the fibroid. Moving on to the next question. Is there a way to determine the weight of a fibroid if you have an estimate of the dimensions? I'm not sure about that. The weight, I've not heard about a way to determine the weight of the fibroid based on the dimensions. Basically, dimensions, well, we can figure out the volume of it. I'm not sure how much that would correlate to the actual weight of the fibroid. And then, okay, here's a very good question. Does most insurance plans cover this procedure? And the answer is absolutely yes. And this is important because insurance only covers 3 procedures for treatment of fibroids. That's hysterectomy, myomectomy, and uterine fibroid embolization. And the reason they cover it is because it's been documented and backed up by the literature, and has lots of evidence-based data to support that it's a very good procedure for treating women. So yes, insurance absolutely does cover the procedure. And I'll wait a second, but I don't see any more questions popping up right now. But I would like to really thank all of you for attending today. I know, like I said, it's taking time out of your busy schedule, and attending a talk is not the first thing everyone wants to do in this day of attending talks all day long. But I appreciate your time, and look forward to hearing from you if you have further interest. Thank you very much.